Hello, healthcare enthusiasts, and welcome to The Cure. We are live at the WHX Lagos floor with Professor Aliko Ahmed. He is the regional representative of the Director General of the Africa CDC, representing the West African Regional Collaborating Center. Professor Aliko Ahmed, thank you so much for taking the time to speak with us.
Thank you for having me.
Of course. So I think when people think about, the CDC and the Africa CDC, people tend to focus on their own individual national body. So Nigerians will think about the NCDC, but your role actually sits higher than that. Your role covers the West African region. So I'd love to hear from you. What does that regional architecture look like from your vantage point?
Well, you explained it already because it's more than just one country. Mm-hmm. There are 15 countries in West Africa. But by the way, it's Africa CDC. We call it not African CDC because Africa CDC belongs to Africa. Yeah. It's for Africa. It's owned by Africa.
I love that.
And Africa CDC also is a brainchild of the member states of Africa. So it's developed, created, and mandated by the different countries in Africa, all the 54 of them. Mm-hmm. So it's a continental premier institution for public health. Yeah. And we haven't had anything like that before because each country tends to do its own thing. But we know we live in an interconnected world. Yeah. The world is getting smaller. We have borders that people, particularly ours, that freely move about. So when you take West Africa in particular, there's a lot of socio-cultural identity that is similar across that patch. Yeah. While people speak French and English, the way we live, our cultures are quite intertwined. But coming back to the health system in itself, the idea of Africa CDC is about the coordination. Yeah. The sum being better than the individual parts. And particularly because we know diseases such as Ebola or Mpox, they're cross-border, they don't respect geographical border. So the added value of Africa CDC is to bring that coordination across multiple countries. At the same time, also share good practice because we can all learn from each other. Yeah. When you have countries like Nigeria with that capacity and population, compared with other small countries like Cape Verde, for example, there's a lot you can learn from. Yeah. So Africa CDC, in essence, is there to complement what each country is doing, share good practice, coordinate, facilitate, convene where necessary. But the ultimate goal is to make sure each of the member countries is strong enough and is resilient.
I love that. I love that response. Thank you for painting that picture. And I think one of the most initiatives from the Africa CDC is the African Pool Procurement Mechanism that aims to kind of aggregate demand and pool procurement so that cost savings are passed on to African patients. And I would love to hear from you. What does success look like for the APP? How does that tie, in your keynotes presentation today, you talked about the Africa CDC having a goal that by 2040, 60% of the drugs and medicines used in Africa are made in Africa. So I'd love to hear how the pool procurement mechanism will kind of feed that goal as well.
I'm glad you've done a lot of your research.
Thank you.
Because the APPM is really an important mechanism for Africa. You cannot believe it in the huge geography we have in Africa and the population of over 1.5 billion people, that 40%, about 60% of the medical consumables, so whether vaccine, drugs, or healthcare products, we import them. Yeah. That means we have less than 40% capacity. Yeah. We don't have our own products. We depend on importing them. So the pool procurement mechanism, what that in essence is saying, is two elements. One, we want to promote manufacturing locally in Africa. Yeah. But manufacturing that meets high quality standards that can be accredited and be seen to be good everywhere in the world. Yeah. So just because it's Africa doesn't mean we deal with low quality. So there's an element of making sure we have the manufacturing capability of high quality products. But then on the other side, the demand side, to make sure that governments and markets are ready to buy them. Yes. Because there's a risk for investment, whereby you can invest into producing things and you don't have a buyer. Yeah. And you can understand that. So Africa procurement mechanism is intended to balance the two, to shape the market.
Yeah.
And the advantage also is we have big countries, small countries in Africa. Not all of them can manage to produce anything. So the idea of the APPM is based on the idea of what we call the sovereignty agenda.
Yeah.
Because Africa wants to move from dependence to self-reliance, because that's the future of it. And what that will do mean is countries don't have to each try to manufacture. What we can do is to take advantage of where there is strength and asset, then we build that. And other countries can do something. Some may produce the ingredients, some may produce the drugs. But an important element is also realizing that we need to harmonize the quality standard.
Yeah.
So that drugs produced in Nigeria can be bought in South Africa and vice versa. At the moment, we have almost 50-something different regulatory mechanisms, which can be a barrier. Also, when you are procuring drugs, countries don't have the volume to do that alone. But when you take Africa as a whole and bring all the procurement in together, that's a strong block to buy some. So that is one of the essence for that. So as I said, two key elements: making sure the supply side, we are supporting manufacturers to get the right resources and making sure it's of high quality, the regulatory mechanism work. On the other hand, also making sure African can buy the drug when it's being produced.
Yeah.
And the fact that Africa CDC is doing that is quite helpful. The Africa CDC is owned by the African head of state.
Yeah.
So that means they can guarantee that when these things are being produced, we can buy them.
Yeah.
The ultimate goal, as you quite rightly said, is by 2040 to reverse that trend.
Yeah.
At least 60% of everything we consume in Africa is produced in Africa. It's a standard that can be consistent across any country in the world, where Africans buy for Africa, and also other members of the world, other countries in the world can buy from us.
Yeah.
So that's the idea: self-reliance and sovereignty for Africa. That's what we are for.
Amazing. Thank you so much. This has been so insightful. We're going to be following your work very closely.
Thank you.
And we can't wait to see how you push forward that sovereignty agenda in this West African region.
Thank you. But we have to depend on young people like you as well, because I think the seed has been put in place now. Yeah. Our African leaders and technical leaders are coming together. And I think it's liberating, it's exciting, it's empowering. We want a legacy whereby we are self-reliant. We have partnership with others, but they have to align to the priorities of Africa.
Yeah.
And that's the objective. Thank you very much.
Thank you. Thank you so much, sir. Thanks. See you in the next episode.